As nurses, it is our responsibility to establish ourselves as professionals in our workplace. Our course, Professionalism in Collaborative Practice, has provided me with the necessary skills to begin my career and interact with patients, their families, physicians, and other nurses in the most professional manner. I have learned that in order to provide the best possible care for my patients, I need to utilize my critical thinking skills, be assertive during conflict, work as a team member, and perhaps most importantly, act as an advocate for my patients. Critical thinking is extremely valuable in the profession of nursing for many reasons. Communicating as a critical thinker allows you to keep an open mind to different choices and patient care options. Thinking critically also prompts you to generate and ask questions as a nurse. It is important to clarify and evaluate evidence in our profession because education in our field of work is never ending. There is always new research or more to learn in the medical field, which means I need to be aware of the changes and be willing and able to continually educate myself. If I have questions or am not positive with my thinking, I need to check any available resources, such as current research articles. If I am still having trouble finding answers, I have learned that it is essential to feel confident and comfortable addressing other nurses or physicians. This is the same for a situation of conflict as well. Our course has taught me how to handle possible stressful, uncomfortable situations as nurses. These settings may occur between the patient and a nurse, the nurse and a family member, the nurse and a physician, or even between nurses. I have learned that in order to most professionally and effectively handle conflict, I need to remain assertive with my words, but also keep my voice and tone at a calm, low level. I cannot be passive during arguments or disagreements because it may negatively affect my patient's care. As long as I maintain a firm and direct, but still polite and respectful message, I think I will be a great team member. Nurses are most often required to work as a unit with other nurses, physicians, or other medical employees such as surgeons or physical therapists. Working as a team will provide optimal healing for our patients. As a professional, I have learned the importance of teamwork. To prevent error and tense environments, I will make sure tasks are distributed as evenly as possible, so not just one person is overwhelmed with the majority or most difficult work continuously. Communication plays a large role in an effective team. I think it would be valuable to implement communication workshops as a part of orientation in order to make sure each employee is aware of the level of professional communication expected of them. Communication is also a key role in building relationships with patients. To best serve as my patient's advocate, I need to communicate effectively both verbally and non-verbally. I want to make sure to spend time to get to know each patient individually so I can provide the most comfortable environment and build a relationship based on trust. I vow to be an active listener with a compassionate heart in hopes to best treat each patient. It is also my responsibility to mediate between the patient and their family and the physician. This course has provided me with the skills to successfully relay information to and from each party with the appropriate attitude, level of respect, and professionalism. As a nurse, my primary goal is to care for my patients, but this course has helped me realize that in order to achieve optimal patient care, I need to utilize critical thinking in intense situations, be assertive during conflict, implement team building strategies, and be an active listener in order to function as the best possible advocate for my patient.